My name is Dr. Manrina Rhode and I am the Aesthetic Dentistry Expert for Dentistry.co.uk. Today we're going to talk about balancing ethics and patient expectations. So I think we've all had those patients come in who want a treatment from us and it's not necessarily what we think is the right thing for them to do. So for example, you'll have a patient who's got gingivitis and they want to have 10 veneers, and you know that you have to fix their gum health before you can do their smile makeover. But they start arguing with you saying, oh, they don't have time to have hygiene appointments every 2 weeks or every month to try and get their oral hygiene right. They need their smile makeover in time for this wedding or this party that they have, this important birthday that they have this summer, and they try and push you to do the work without getting their health work done first. We've all been there, right? And it's tempting. You'll start looking at them and kind of think, okay, like, have you got a high smile line? Will it show? Okay, so the risk is if I don't treat your gum disease before we do this smile makeover, then when you do treat your gum disease, which inevitably you're going to have to do, or even if you don't, then your gums are going to shrink, but if you do, your gums are going to shrink. Then when the gums shrink, are the margins going to show on my work? Am I going to end up having to replace your work for you? Oh wait, they haven't got that higher smile line. Maybe I can do the work, and maybe if their gums do recede later, it doesn't really matter because no one ever sees it. And you kind of find yourself trying to reason in your mind about how you can give this patient what they're asking you for, because that's who we are, right? We provide a service and we want to help our patients. When they tell us they've got a deadline and they want something done by a particular date, we want to do it. But there's so many risks associated with that. Like, not only we also know that patients don't always understand, as clear as you might be, as much as you may come to that understanding that, look, you need to fix your gum disease and you will get some recession later on, and I can do your smile makeover, and when you get the recession, it won't be massively visible, but your margins won't be perfect. You can explain that to the patient, you can write it in a contract, you can get the patient to sign that for you. But if and when that does happen, when their gums do recede and your smile makeover is no longer perfect within 6 months of it being done, you don't really have a leg to stand on. If that patient, if your work is imperfect and they want their money back or they want you to replace your work free of charge, whether you've had that contract signed or not, you are liable to provide the patient with the correct treatment. And so don't compromise to please your patients. Not only that, try and naturally do a smile makeover on a patient that has any form of gingivitis. Bleeding gums are impossible to take an accurate impression of. It's impossible to put temporaries on without kind of getting blood underneath the temporaries, which then make them look black and really strange, or God forbid you get blood on cementation phase and you kind of cement your veneers and then you get black underneath your veneers where there was a little drop of blood that kind of spread in with the cement. So there's just so many disasters that are waiting to happen by taking a shortcut, and I know it's tempting when patients want it, but I think as clinicians it's so important to remember the importance of doing things correctly and ethically, and health before beauty. But I think health equals beauty, so helping them understand the importance of the health of their mouth so that they can then have their perfect smile makeover. My patients, I tell them about what we can do, but then I tell them, now you won't see me until your gums are perfect, until my hygienist signs you off and tells you you're perfect. So then you put the onus on them. If you see the hygienist, if you carry on with great oral hygiene at home, then I can do your cosmetic work for you, but I can't do that for you until you do that. And I think it's important to take the reins back and stay in control and stick with what's important to you. So let's all keep that in mind. Also, there's that difficult conversation in aesthetic dentistry about if a patient wants porcelain veneers or composite bonding and their teeth aren't perfectly aligned, and you want them to align their teeth before you do that work for them, and they're trying to kind of convince you that they don't want to pay for the brace, they don't want to wait another 3 or 4 months and straighten the teeth first, they don't want to retain their teeth afterwards, they just want you to go ahead and do the work, and then you kind of need to work out the repercussions of that as well. And really it's tempting to just be like, well, yeah, actually I just quite want to do the fun bit of work too, but you'll make your life so much easier by doing your treatments in the correct way and insisting they have their brace first, their pre-alignment. We used to, back in the day, I think probably in 2008, I kind of remember this whole change of working, this like a more conservative way of doing cosmetic dentistry. I'll be really honest with you. And before then, I mean, I graduated in 2002, and 2002 to 2008, we were doing that TV show, 10 years younger, and all these smile makeovers. I was doing like 10 or 20 units a day, and we would just cut the teeth wherever we needed to, do elective root canal treatments, and just do their smile makeovers for them. That's the way things were done back then. And then, you know, all these other brands of alignment came in that made alignment easier for GDPs to do. I mean, I was working with an orthodontist back then, but we only used to refer to him in really extreme cases. And now there's so many options available, right? I don't need to go through all the brands with you that you can use for pre-alignment. But now to do dentistry in that way would be completely unethical. To not get them to align prior to your treatments is not what you would do for yourself, or, you know, they could talk about the daughter test. It's not what you would do for your family. So don't do it for your patients, even though they might think that you're doing the best for them by doing what they want. You're not.